Hello everyone, Dr.berkkkaratas. There are many videos on the channel about premature ejaculation. We had made a series about this, but I want to do the same for erectile dysfunction as well. I want to provide a bit more practical information. So, how do we treat patients? It's more about practical knowledge than theoretical. How does the workflow go? I will try to explain that. Now, the definition of premature ejaculation is as follows. Let me do that first. Because we don't determine premature ejaculation based on someone who doesn't have sexual intercourse or based on the situation during masturbation. At least 3 to 6 months, there should be at least 3 months of a relationship, and this relationship should be regular. Individuals will ejaculate before entering into intercourse right as they enter or within less than 2 minutes. Now, of course, erectile dysfunction is very important. It's not correct to assess premature ejaculation in individuals with erectile dysfunction. First, that needs to be treated. But if there is mild erectile dysfunction, both premature ejaculation and erectile dysfunction can be treated at the same time. So what do we pay attention to? When our patients come to us, when did this premature ejaculation start? It's very important. Was it from the beginning or did it start later? So you have a partner for 10 years or you're married. I've had premature ejaculation from the very beginning. Or you might say, no, everything was fine for 9.5 years. For the last 3 to 5 months, you might say that in a strange way, I ejaculate very early in a way I don't understand. First, we need to make a distinction because, frankly, we do not expect a disease in premature ejaculation, which has been there from the beginning. So a person can't have Goethe's disease for 10 years and have premature ejaculation as the only symptom. Other issues will definitely arise. That's why we don't do a lot of research tests, blood tests, etc., in cases of premature ejaculation that have been present from the beginning. So why does it happen? There are 2 situations. There is either hypersensitivity or a behavioral disorder. What we call a behavioral arm disorder is more about that. Mistakes related to masturbation, mistakes in ignorance regarding sexual life are very important. This is about doing masturbation in a hasty, careless way, like rushing through it in the bathroom just to get it over with. This is about doing dry masturbation. An even more dangerous thing is to masturbate by rubbing. All of these will come back to us in our sexual life. As premature ejaculation, it's coming back. What does hypersensitivity mean? In some individuals, the head of the penis and the area just below it, which is where the urinary tract passes, can be extremely sensitive. I call this like being tickled. So some people are very ticklish. Some people are never ticklish. Of course, there are many mechanisms underlying this, but I won't explain them right now. This situation occurs mainly because there is a problem related to the serotonin hormone. So what do? If there is a behavioral disorder, we provide behavioral therapy. We forget what we know and start everything anew. And we provide such a treatment. In the treatment of hypersensitivity, there are medications such as creams, sprays, and pills. How do we use both the behavioral therapy and the cream? I had prepared an application video. I had prepared how to use these pills, but by the way, there are 2 very important things. Let me say that when using the cream and spray, you only need to apply it to the sensitive area. Applying it to the entire penis is not a very correct approach. Then the penis completely loses its sensitivity. This time there is erectile dysfunction. There are long-acting pills among the medications, so there are pills that need to be taken regularly every day. There are also pills that need to be taken before the relationship, just like with erectile dysfunction. I prefer pills that will be taken every day, especially for those who are married and have regular relationships. Because taking medication before the relationship is it develops into a dependent psychological condition. We're trying to treat it this way. It depends on the patient's condition. So what happens if the issue started later? If it started later, the first thing I do, or rather what needs to be done, is to conduct a behavioral assessment. So we're questioning why this happened. Here is the winter before. Married, lived a long period of celibacy in between and masturbated. They may have done something wrong or engaged in inappropriate behaviors, or they might have just recently gotten married and it could be only 2, 3, 4 months since then. In such situations, it can sometimes happen. So what's abnormal is different from before. But more importantly, of course, I mentioned it before, tests are very important because some diseases are quite important for us. In this behavioral assessment, if there is a problem, we conduct behavioral therapy, and we can also do medication treatment. In tests, Infections are the most important cause, right? Especially in those who have started experiencing symptoms in the last few months. Conditions like prostate disease, prostate infection, and sexually transmitted diseases are significant. Graves' disease, which is a condition of our thyroid gland, is significant when it is overactive. Advanced diabetes, hypertension, heart disease, hormonal disorders, testosterone imbalances, and prolactin hormone imbalances can cause this. We definitely look into these. If there are no issues with these, if the issue is a narrowing, we provide treatment for narrowing just like we do here with medication. Well, we did all of this, we questioned everything, and we carried out the treatments, but we didn't get any results. So what are we going to do? There are some methods, they're not very commonly used methods. Let me say this from the beginning. I don't use some of them at all. For example, hyaluronic acid injection can be done into the head of the penis. So, especially when we inject this between the skin and the subcutaneous tissue, we know that there is a decrease in sensitivity. Of course, hyaluronic acid is a substance that can be absorbed, so when it's placed there for a lifetime, it won't last a lifetime. Women do this around their lips, features, they do it on their cheeks and such. It is used as a filler, but as I said, it is absorbed again within 6 months to 1 year. If it proves to be beneficial, the other methods also need to be repeated every 6 months. This is called penile dorsal nerve ablation, which specifically damages the nerve that provides sensation to the head of the penis. This is especially practiced in the Far East, but it can lead to some erection methods and cause numbness throughout the entire penis. Honestly, I've never used this method. I'm not thinking of using it either. This modulation of the dorsal nerve of the penis is a slightly different situation. You're not completely damaging this nerve, but you're changing the frequency of the nerve. With radiofrequency methods, there isn't much information about this. So, there's no information about its applicability in the world. The study that has already been conducted is a study conducted in Turkey. They conducted a single session and say that it was quite successful in the patients. But we really need more studies and more information to implement it, to be able to apply it correctly. In conclusion, I explained it practically this way. Still, it took a long time. But you might have imagined something in your mind to some extent. First of all, let me say this. Premature ejaculation is a condition that can be learned. If the disease is mild, it can be treated 100%. We need to remember this. Thank you.